Hi, today I'm going to discuss the worst case scenario of the COVID-19. And before we get into the discussion, let's have a look at this current coronavirus pandemic. And as of today, March 18, 2020, and the total case in the world is 208,471. And total deaths is 8,312. And that number will expect to increase rapidly because the coronavirus infection is in the full speed. And maybe easier for us to see the dynamic of the COVID-19 infection in terms of the graph. And here's the total case and total death. And in both cases, and the trend is up, and it looks like it reached exponential phase. And we don't know how long this situation will persist, but we know that so many countries have this epidemic, and that case and deaths will continue to increase for some time. And let's look at individual countries to see the cases in. And the coronavirus is affecting 170 countries and territories. And the epicenter right now is still in European country. And Italy is one of the most affected countries. And I don't recall this new case for today, but yesterday there are more than 3,000 new cases and more than 300 deaths. And other European countries almost follow the step of Italy, like Spain. And right now, today, they have more than 2,000 cases and close to 100 deaths. And similar situation is happening in Germany, France, Switzerland, UK, Netherlands, Austria, and also Norway, Sweden. Almost all the European countries all have significant increase of this new cases, and thus also have some death. In United States, today they have more than 1,000 cases, and this number I will also expect to increase significantly because their policy is to test as much people as possible. And also they have a very good collaboration between government, academic, and also private companies. So they have, start from this week, they will have full capacity to test almost as many samples as possible. So this number will going to catch up very, very rapidly when easily pass the Italy, maybe become second after China. And the time will tell if this is true or not. And also in the Middle East, Iran still the major epicenter. So today there are more than 1,000 cases and more than 100 deaths. And another worrisome sign that appears in this map is that many of the African countries also start to see the case, the pick up. And this is, if we don't prevent this happening in African countries, they're going to have a huge disaster for the continent because in African country, the healthcare system is not as well established as in the place like China or in the United States. In this well established countries, if we try our best, we can control the situation within 1 month. But of course, we suffer from economic shutdown. But in the every country, and they have very limited resources. First of all, the healthcare system is not as well established as many of rich countries. Secondary, and the doctors are very limited doctors, so much less than in the rich countries. And we can, at this stage, I hope that all African countries can take preventive measure to try to prevent the virus getting into the country and to prevent this disaster. And so this worst case scenario already happened in China and Wuhan, Hubei province. So when this epidemic comes, because the viruses have so high infection transmission rates, so they will rapidly infect so many people, and the COVID-19 patients will overwhelm the hospital. So, and there's no potential to take care of the patient. First of all, they have no facility, and second, there's a limited doctors. And so in China, they did a very good job. And in just a few days, they built 2 emergency hospitals. And for medical staff, China mobilized doctors from all over China. Maybe more than 50,000 doctors from all over China went to Wuhan to help them. So that's why they have controlled the situation very rapidly. And now, same situation happened in Italy. And so, the COVID-19 patient is overwhelmed ICU. So, it's really kind of decision which one need to go to the ICU, which one we cannot go. So, in here, you just like a warehouse become a patient ward. That is really worst case scenario. So the patient have no proper medical facility. That is really tough. And so the real cases already happened in so many countries, in China, in Italy. So let's have a look at the case in United States. So here just give based on the hypothesis that the current concerns is that if we don't take very active measure, and more than 40 to 70% of the population will get infected. Among this affected patient, 10% to 15% need hospital care. And take US for example, if we take the low estimate, 40% of the population can get infected, and that's about 130 million people in US alone. And if only 10% of them need hospital care, this is 30 million people. They need 30 million hospital bed. However, based on current situation, the entire United States has only about 1 million hospital beds. And also most of the bed was already occupied. So maybe only 10% or 20% of house beds still available. And that's really serious situation. That's not because the United States maybe have one of the best healthcare system, but you see the pressure on the country right now. That's why it's really nice decision right now for the country to try to prevent people from the infection. This prevention is very important. If we get into this stage, 40 to 70% of people will get infected. That will be disastrous, and many people will die simply cannot access the healthcare system. I think this ways to prevent it from happening, and also even so this is happening, we still have a lot of novel ways to deal with the situation. I see the news today from that United States President Donald Trump, all this Navy hospital was sailing into the New York harbor. So in this ship alone, there are more than 1,000 beds. So, and also right now along country, you can think about modify these hotels and make it as a patient ward, or also maybe the not of cruise ship in United States. In the cruise ship, there's so many rooms. If we can modify that to help the patient to relax this the entire hospital pressure, and I think there's ways to deal with. And again, the most important thing is to prevent this from happening. Prevent this virus get into your body, to prevent it. And that in my previous video, I have talked about many times that how to deal with, how to avoid this coronavirus, and also there's so many ways in videos you can find how to prevent yourself from this coronavirus. And also another important thing is that you need, in this special time, you need to build up your strong immune system. And if you have strong immune system, even though the virus gets into your body, you still have the potential to kill the virus. And then many of the things are pretty simple. You just need every day to just make sure you're relaxed and have very nutritious food and have good night's sleep and drink a lot of water, and also do some exercise. Try to eat some supplements such as vitamin C, vitamin D, and all this is a very simple procedure that can build up your strong immunity. And I think that we all need to wish for the best, but we need to prepare the worst. So we need to be ready for the potential disaster along the world. So everyone needs to take action to do something. So all of us together, we can ensure we can conquer this virus, and soon we will be virus free in this world. And that's it for today. And thank you for your attention. And if you like my video, please subscribe my channel. And bye.